Hello again. I'm Joe McTurnan, AOPA's Director of Health Policy and Advocacy. Thanks for joining me today for another edition of AOPA's Take. Today we're going to discuss an issue that AOPA, the Academy, ABC, and BOC have all worked collaboratively on over the last few years. The potential value of the individual NPI in advancing the recognition of orthotists and prosthetists as true allied healthcare professionals. The NPI, or National Provider Identifier, is a single, unique identification number that was created for use by all HIPAA-covered entities to support administrative simplification and consistency in healthcare-based transactions. All health plans that are covered under HIPAA, including Medicare and Medicaid, are required to adopt and use the NPI as the primary means to identify enrolled providers. Providers are required to use the NPI for claim submission. There are two types of NPI numbers that are issued by the National Plan and Provider Enumeration System, or NPPES. Type 1 NPIs are issued to individuals such as physicians, non-physician practitioners, and allied health practitioners, including orthotists and prosthetists. Type 2 NPIs are issued to organizations such as hospitals, group practices, and healthcare facilities, including O&P facilities. Historically, O&P providers are classified as organizations and therefore use the Type 2 NPI numbers assigned to the entire facility for claim submission purposes. While these are no barriers to prevent individual orthotists and prosthetists from obtaining an individual NPI, because they are not currently used regularly, there has not been significant adoption of individual NPIs by orthotists and prosthetists. Over the last several decades, orthotists and prosthetists have evolved from artisan-based professionals to true allied health practitioners. Advanced education, formal residencies, and clinical expertise have facilitated the incorporation of orthotists and prosthetists into the overall rehab team. One way to continue to support the recognition of orthotists and prosthetists as allied health practitioners is to encourage the application for and adoption of the individual NPI that would be used to identify the actual orthotist or prosthetist responsible for providing care to their patients. While this is part of the long-term strategy to improve recognition of orthotists and prosthetists, it is a step that can be taken now in that we are best prepared as a profession for the future. Thanks for a few minutes of your time today. And as always, AOPA's Take, where you go when you need to know.